As you watch your child grow, it helps to remember that children develop at their own pace and the range of normal is quite wide. However, it is helpful to be aware of red flags for potential developmental delays in children. A developmental delay is a lag in development that results in a child's functioning at a level below the norm for their age. Some warning signs of possible developmental delays include a child not responding to sounds, not babbling by 12 months old, not walking by 15 months old, not using hands to manipulate and explore objects, or if by age 3 a child does not show interest in other children, has limited or not use of words or gestures to. The term developmental delay is used to identify infants and toddlers who would benefit from early intervention services, but who are not being labeled with a specific disability. The most important piece of legislation on behalf of infants was enacted in 1997 under the Individuals with Disabilities Education Act, IDEA. It required that all states develop and implement programs for early intervention services for infants and children at risk of subsequent learning, growth, and development. Early intervention is a system of comprehensive services and supports in the areas of education, healthcare, and social services provided to infants and toddlers. Early intervention focuses on helping eligible babies and toddlers learn the basic and brand new skills that typically develop during the first 3 years of life, such as reaching, crawling, walking, thinking, learning, talking, listening, understanding, playing, feeling secure and happy, eating, and dressing. The first step in the assessment process of any child suspected to have a disability or developmental delay is referral. A referral could be done either by a parent, healthcare provider such as the child's pediatrician, a daycare provider, or any other individual who suspect the child is not meeting age milestone. If the child is younger than 3 years of age, the health department is in charge of contacting parents on a written statement about the evaluation process. When the child reaches age 3, the Committee on Preschool with Special Education, CPSE, takes over in evaluating the child to determine whether or not the child is eligible for further services or a school district if child is already attending school. During the referral process, family members are informed of the benefits of early intervention and a service coordinator is designated. The service coordinator will explain to parents the process and the steps of the evaluation process and the rights as parents in which they must sign consent in whether or not to continue further evaluation. Screening is the next step to follow the referral. The screening main role is to raise a red flag if a problem is indicated. It may suggest that further evaluation of child's needs and functioning level is necessary. Parental involvement plays an important role during the screening process. Since parents are the ultimate caretakers of their children, they can provide valuable information through interviews or checklists. Full developmental assessment typically includes evaluation of sensory, cognitive, fine and gross motor, and language development. Parents and professionals work together to accumulate useful information regarding children's current developmental levels and developmental history. Full assessments are provided at no cost to parents. According to mandated federal laws, it's required to provide appropriate diagnostic instruments and procedures. As per the most recent version of the IDEA of 2004, it emphasizes the need for non-discriminatory evaluations. The use of a variety of assessment tools and strategies should be considered to gather relevant information about the child in which they should not be racially or culturally biased. All assessment must be administered in the child's native language. Once a full evaluation is complete, a child receives early intervention program support and the development of an individualized family service plan, IFSP, for children birth to 3 years of age. An IFSP is a written document outlining early intervention services. It is individualized because it is designed to meet the specific needs of the child involved and emphasize on the concerns and outcomes the family hopes to achieve for the child. Parents must sign consent for all evaluations. They are held accountable for the decisions made on behalf of their children. This means parents have the right to whether or not agree for evaluation. When planning services for a child whose assessment indicates the presence of a developmental delay or disability, the child's strengths and weaknesses in that particular area must be analyzed in depth. The committee shall recommend approved appropriate services and/or special programs and the frequency, duration, location, and intensity of such services. Monitoring involves evaluating the usefulness of the services. It requires that all aspects of the service plan be recorded in details, such as who is responsible for effecting the plan, what implements are needed, and how soon the goal should be reached. Many studies and literature reviews report that the earlier the intervention, the more effective it is. With intervention at birth or soon after the diagnosis of a disability or high risk factors, the developmental gains are greater and the likelihood of developing problems is reduced. On the other hand, the cost is less when intervention is earlier because of the remediation and prevention of developmental problems, which would have required special services later in life.